Shiraz Farouk.
Hi, good evening. I'm Sydney, Dr. Farouk's wife.
I'm DaBootyDoc, and we're coming to you live from Tampa, Florida for the first time ever. We're very excited to have you here, guys.
Yeah, that's right. We wanted to share with you today, so we're starting an educational program about the booty.
DaBootyDoc is here for you.
So basically, our goal is frank conversations with a proctologist. Dr. Farouk has a lot of experience. He started this colorectal practice, Colowell America, which you can see here. And that's been 4 years now. So we've seen thousands of patients, and it's about time that we start sharing some of the things we learned.
Thank you, everyone, for joining in. We are excited to be here live on multimedia. As you know, everybody is trying to get more information, and some of the social media out there can help you learn something. So we thought, why don't we use this opportunity to talk about some common stuff? And this is how the DaBootyDoc Talk was formed.
That's right. So we came up with this idea, the Booty Doc Talk. We're going to be talking to you once a week. It'll be Thursday nights at 7 p.m. We have different hot topics. So tonight we're going to talk about constipation, everyone's favorite.
Because America's favorite problem is constipation, guys. We are all full of it. So here we are talking about poop.
But first, we wanted to kind of give you an idea of how we got to this point, and we wanted to discuss what our goal is here.
Yeah, so as a board certified colorectal surgeon, I've seen thousands of patients in my life, and I speak to patients in my office. Going public and talking to people live is an opportunity, so we can talk in layman terminology, add some humor, and make it easy and mix it up for you guys. So,
and how we're going to do it is by having you guys give us your questions weekly. So we'll put our topic out there at the beginning of the week, and then you can ask away on our social media, give us some, opinions or maybe some things that are on your mind, and then we'll share them here during our half-an-hour show.
Thank you very much. So this is 30 minutes of time with us where we will be chatting about common stuff. Today's topic is lowdown on constipation.
And hopefully we'll keep you smiling a little bit. So we have plenty of colorectal jokes around here. So I'm going to ask Dr. for a couple of questions that we got from our team and our patients in the area. Of course, conversations about constipation. So if you don't know what constipation is, let's discuss and tell us a little bit about how it affects the body.
Well, guys, constipation is a problem which you can have from the very beginning of your life till the very end. So it basically means a difficult time evacuating your bowels or pooping, or if you're having very hard stools and you cannot move them and you're having pain and discomfort and stuff like that.
And where's the pain usually associated?
So constipation usually means that you are not able to have a good bowel movement, and the pain comes from the gastrointestinal lining of the small intestine and the large intestine, mostly the large intestine.
Now your stomach's pretty big. It's kind of how many feet long?
Well, the colon can be about 6 feet long in some human beings. Yes.
Some human beings.
Some human beings. Most of us.
Newborn babies?
Yes, they will have smaller colons, definitely.
So abdominal pain, of course, discomfort. What about severe pain?
Severe pain, if you are constipated for a long time and you have not gone to the bathroom and evacuated your bowels in many days, then that can cause severe abdominal pain. And that could make you double over, sweat, become nauseous, bloated, belching, not able to fart, or difficult time farting or passing gas, if I say it publicly. Mm-hmm. Yes.
So when this happens, you might get concerned. How many days should someone wait? What's normal? Does it depend? I mean, some people say they have a bowel movement twice a day. Some people say every other day. So when should someone be concerned, depending on their system, their own body?
You should be very, very concerned if you're not able to have a good bowel movement every second or third day. I would say that's pretty normal. Most people in the world will move their bowels at least once a day or once every other day. There are, however, people who go once a week. There are people who go every 2 to 3 days. I think anything beyond a few days is a cause of concern in most people, because it will cause you to have a backup of your food that you have ingested and the plumbing is not working, so that'll cause some issues.
I see. So after 3 or 4 days, see a doctor? Do I try over-the-counter medications? What's going to work for me?
Well, constipation is one of these things that most of us try to deal with at home at first. So the common...
You mean you don't call your mom immediately and let her know?
No, I don't think I'm going to call my mom immediately and say, hey, Mom, I can't poop. Though she will be upset and will give me a remedy that will work probably.
She does have a lot of remedies.
Yes. Home remedies are very common, and most people, when they're not able to poop, the first thing they do is they drink more water. And why is that important, you ask?
Actually, I was going to ask that because when I was thinking about this, I know we tell our patients all the time, drink plenty of water. It definitely is something that comes out of our mouth every single day to every patient. But I was wondering why.
Well, hydration is important because we are about 96% water molecules. So human beings are bags of water. So inside us are cells, and a majority of the cell is made up of water. So expand that to a whole human being, and we are full of water. So if you're constipated, your intestines and your colon is not getting enough water to move the excrement and the juices and the food out of you. So you're not flushing it accordingly.
So the water is not actually moving the food, it's helping the cells be healthy to do the processes that they need to do.
I think it does both. It helps to flush it and it helps to keep you hydrated. So the cellular function of the colon is happening at the same time.
And that is something I gotta consider. I mean, I know it's just poop, but think about the process that it has to go through to get from top to bottom, A to B. So there's a lot going on that you have to consider about your own bodies.
Definitely. I mean, like when you ingest something from your mouth, you take a delicious slice of pizza, a cake, an apple, or something amazing. All of that is going to make you hungry. But the other end is usually the same for most people, and it has a particular order and consistency, etc. But it looks like crap, which is poop.
But we have to be conscious of what we're doing. So that's part of it too. We were talking about over-the-counter remedies. So other than medications, there's natural remedies, medicinal remedies.
Yes. So if you're at home and you're not able to go to the bathroom and evacuate your bowels for a while, the first thing is that you're going to try and drink some water. Second thing we would advise as medical professionals and laymen people should also do is add more fiber, because fiber in your diet is so important because it acts as a brush to clean your colon, and that's very important.
Does fiber also enter your body on a molecular level, or?
Most of the fiber can be divided into two kinds, soluble and insoluble. So I try to give people the example of a sponge and a broom. So soluble fiber inside your bowels is like a sponge, which is wet and soggy, and you can clean the colon. And the brush is the insoluble fiber, the one that you cannot digest, and that acts to clean the colon out and brush it. So both soap and water, sponge, and then a brush helps clean your colon and make you less constipated.
So that's a pretty good analogy for fiber there. So think of it as a scrub brush going through your colon.
I think so.
Like that.
Yeah.
Fiber,
yes.
do you use a supplement? Is it
So most commonly we advise our patients to add more fruits and vegetables. And fruits and vegetables have both soluble fiber and insoluble fiber. I give you an example of an apple. Apple has both soluble and insoluble fiber. The outside skin, which a lot of people don't eat, I know my father doesn't eat the outside skin and peel, that is mostly insoluble fiber.
This is a question for Marion later.
And Marion is one of the receptionists that works
but
with
she's
us.
very particular about everything, so I want to know how she feels about the skin of the apple.
So the skin of the apple and various other fruits and vegetables that we call roughage. That's the part that you have to chew a lot and masticate, and that comes out like the brush and cleans you out. It's not absorbed by the body. And the soluble part of the apple, which is the flesh, has pectin and other fibers and other chemicals that become like a gel, and that sponge and bloom action of the fiber itself cleans your colon. So fruits, vegetables are the biggest plant based diet addition that we want our patients and the public to do.
What are types of fibers that you find in products?
Give me an example. Like, what do you mean products?
Like I always see psyllium husk or inulin on fiber products.
Oh yeah, so there's many different kinds of fiber, like I explained, and inulin is a chemical form of this fiber that we have, and psyllium husk is another fiber from plant.
I think chicory root.
Chicory root is inulin, and these fibrous products have been formulated into many medicinal uses, and sometimes they can be in a gummy, sometimes they can be in a pill, sometimes they can be as a powder. So these fibrous supplements from plant material go inside your bowels and do the same. They clean it out.
Interesting. So better fiber.
It depends. There are very different kinds.
Should I have both? Should I be eating fruits and vegetables at home, but also taking fiber supplements?
So the American diet, and most people on this planet don't eat a lot of fiber. Okay, in the Western diet is deficient, and we have a lot of processed foods. So we're eating about 10 to 15 grams of fiber. In the other parts of the world, where there's not so many processed food materials like cheese and pizza and donuts, we are eating lentils and legumes and nuts and breads of different kinds that are made from plants, and those plant materials are very rich in fiber, and that fiber allows us to clean our colon every day. So those people have a healthier bowel movement and less constipation.
So if you're eating more plant-based diet, you're going to probably have a higher fiber content. But maybe if your diet's more packed with McDonald's or the on-the-go processed foods, even if they're coming from the grocery store, you might be consuming less fiber daily. So you mentioned 10 to 15 grams. I think I've read 25 to 30.
Well, no, 25 to 30 is what we require, but most Americans and most people in the West do not take that much.
But that's what I was getting at. That's our like ideal amount of fiber. So maybe fiber supplements daily could contribute to that.
That's a very good point that you're making, that we have seen that supplemental fiber seems to help our improve symptoms of constipation. And I'm being a little slow here trying to make everybody understand, because there's a lot of words that are coming to my mind, and I'm making it simple, that eating supplemental fiber can be very helpful to you, yes. And there are very various different forms of them. My personal favorite is flaxseed fiber. And I've been advocating that for 15 plus years. I have thousands of patients that have ingested ground flaxseed, put it in cereal, oatmeal, yogurt, smoothies. And that seems to do magic. So that has soluble and insoluble fiber, and that seems to help them. So I recommend flaxseed fiber also.
So that's your topic. If you're picking a fiber food, flaxseed fiber is your superfood.
Yes.
So I
So another thing I was talking, when you were talking about common ways to improve constipation, exercise is very important also. Okay, people if they live a sedentary lifestyle and they're doing desk jobs and not moving around, you're not going to be able to move it, and that's why they say move it, move it. Okay, so if you exercise, there's a very good chance that your bowels will move very nicely.
I was actually reading an article, and they mentioned if you consume, what was it? Consuming something and moving around a little bit. It was a type of food.
Was it like a jelly in your belly?
Yeah, exactly. They were telling you to do a little dance, but make sure you're by the bathroom. Let's see.
Well, I mean, like people who exercise can actually have a better bowel function. So
That's right.
That is very important.
Prune juice.
Prune juice, yes. Prunes are very rich in fiber. So, as a soluble and infallible form, prune juice is recommended by health professionals everywhere in the world. So, yes, dates, lentils, legumes, a lot of plants have fiber, and that's something that we will be talking in the future also. Apart from that, there are also many medical conditions that can cause constipation. So, if you are diabetic, if you have medical condition like obesity, if you have thyroid problems or hormone problems, and many other issues can slow your intestines down and can cause constipation. So it is important that we help fix those problems for those people.
We have a lot of surgical patients too, and they have to take medications afterward for pain. I hear you say to them a lot that that's going to cause constipation for them too. So even medications that you're taking for other conditions could cause constipation too.
Yes, that is very important, guys. There's a lot of us that have to take medicines every day, and side effects of a lot of medicines include nausea, vomiting, diarrhea, and constipation. So you will see that on almost every medicine out there, because a lot of these medications are changing the function of the intestines and the colon, and the contractibility and ability to move the bowels is not as good. So if you take pain medicine like narcotics, that can slow your colon down. So you need to exercise, you need to drink water, and you need to eat lots of fiber, because those things will help you improve your constipation.
Okay, I got one for you. This one I'm always wondering about.
Okay.
Do you push or do you wait? Because sometimes you have the urge to go, but then you sit down and nothing's happening. And they tell you not to sit on the toilet all day. So do I push or do I wait?
That is a very good question, because this is very important. Like I said, to poop or not to poop is a social problem. If you are giving an exam, if you're in an interview, if you're about to go on an airplane or some other problem, you may not be able to go, and you have to curb your enthusiasm at that time. Usually, most human beings have what's called a mass contraction inside their colon that starts from the right side of the colon for most people and moves all the way to the end. And this mass bowel movement, like contraction or ability of the colon to move, pushes everything from A to Z. And that usually happens once or twice a day for most people. If your body remembers it, or if you are attuned to it, and you're like, I have to go, then raise your hand to your teacher and say, teacher, can I go to the bathroom right now? Most commonly, if you do, you will have a good bowel movement. And if you hold it, you stop it, and you resist the urge, then that is going to lead to a backflow and backup of your food products, and they will store inside the rectum, where the fluid will get absorbed out and they'll dry out. So dry poop is harder to push out. So you will have a difficult time pooping. Hi guys, how's everybody? I see some of our people joining in.
What's going on? So good answer, except that wasn't what I meant exactly. But what you're saying is, if you get that urge, you should go at that time, because that's your body doing its process properly. And if you wait, then you might back things up. It might lead to hard stools, more constipation, things that aren't as easy to deal with.
Correct. Totally. I did raise my hand and say, hey, you want to go to the bathroom? Go right now. Please don't wait.
Which that's another good question, because yes, that happens sometimes. You don't in that moment, you can't go. So I do think that's important too. But what I mean is, when you feel like you have to go sometimes, but it just won't come. You're just sitting there, you're hoping, praying, but nothing's making a move. Do you come back another time? Do you push until you make it? What do you do to get to the finish line?
Okay, so constipation and pushing a lot can also cause hemorrhoids and can cause various other problems. So we haven't touched on any of those, which we will in future discussions. However, if you have to stay on the toilet for a long time, and if you have to push a lot, then don't do that. That means that your body signals are not appropriate, and you may not have the ability to evacuate your food out of you at that time. So turn off your phone, wipe, wash, and wash your hands
Walk
and
away.
walk away. That's what I would say at that time.
Okay.
With a smile.
Now, you mentioned hemorrhoids. I'm glad. I know we'll definitely talk about hemorrhoids in
Well,
future
of course,
episodes.
DaBootyDoc will definitely talk about the hemorrhoids. Yes.
But people maybe don't know a lot about hemorrhoids. Maybe didn't even know that constipation could cause hemorrhoids, or what is a hemorrhoid. It's a whole loaded question. But how does constipation cause hemorrhoids? Just simply.
So hemorrhoids are blood vessels that come out, and sometimes they can protrude and prolapse. And it's a mechanical problem. So if you have to squeeze a lot and push, and that can cause the hemorrhoidal blood vessels to get dilated, congested, and they grow bigger and bigger until they start bleeding or cause pain, etc. So long-term issues with constipation, definitely avoid those and eat more fiber, exercise, and drink plenty of water.
Yay. Okay, so yes, you might notice maybe blood in your poop or things like that caused from constipation because you're having hemorrhoidal issues that you don't know about too. So that's where I was going to get to next, actually, because I want to know, how do we diagnose this? How do we treat it? We talk about what to do at home.
Correct.
But when do we see a doctor? So we discussed getting over-the-counter medications, exercising, your diet, doing things. Oh, I meant to ask you too. I've heard about like belly massaging.
Oh yes,
Or,
belly massaging,
or like
exercise,
breathing
breathing
techniques.
techniques. All of those things can help you move your intestines, and that's where after a big meal we are like, wow, I had a lot of food, and overeating can cause constipation too, guys. So that's very important.
That's a big one. Okay.
Big one, guys.
We're
Stop
guilty of
eating
that
so
too.
much.
Our mom feeds us too much. Okay, so does your mom do that too? She's like, have another plate. And you're like,
Yes. I blame all moms for that. Okay? Mom, if you're listening, I love you, and I'm very happy that you give me a lot of food. Thank you very much.
It's worth it.
Yes,
Every
yes.
time.
So,
So how do you get diagnosed, treated?
So constipation, after taking a complete history, and if you're not improving at home, that you need to go see a healthcare provider. That would mean that you go to a doctor or some other provider who will take your history, find out what is going on with your life. Then they'll do what's called a physical examination. They'll look at you from top to bottom, sideways, upside down, and then massage your belly.
We have a chair for that.
Feel your belly, see if you have abdominal distension, bloating, if you're passing gas. They may also do a rectal exam where they put a finger up your hiney. And that can happen in some cases. I guess I can't do that on public radio or public TV.
I'm just teasing.
But a digital rectal exam can give you some information about the exit, if the exit is blocked or some other problem like tumor or hemorrhoids or cut or inflammation. Then you may require an X-ray where we can take an image of the abdominal cavity. Sometimes we do what's called a CT scan, which is a higher and more advanced imaging technique. And sometimes we do what's called a colonoscopy, where we pass a camera from the bottom and look inside. In order to do that, you have to go to a hospital or a surgery center, drink medicine, clean your colon out, and we can look inside. So those are some of the diagnostic ways to find out if you're pooping or not.
I want to talk about these individually. You said you can feel. So you're telling me you can diagnose my constipation just by touching my stomach? What are you feeling for?
Well, if you have constipation and if you're bloated and if you have a lot of gas, then your belly's going to be bigger than normal. And if you tap on it, you may feel it hollow, or it may be full of fluid, or it may be very dull. It could have pain, and you could be very tender to touch. So those are examination techniques which you have to learn in medical school or go to a healthcare training session. But healthcare providers are able to identify certain problems, and physical examination is a huge tool for that.
Is it specialists only? I mean, you're talking about kind of broad range of providers, but you did mention a finger digital exam. So is that something only a specialist can do?
No, I mean,
Do you recommend going right to the source?
a lot of healthcare providers, including general practitioners, internists, gastroenterologists, and many other physicians, are able to diagnose and sometimes treat constipation issues, because constipation is a common problem. I mean, a lot of medications cause it, a lot of diseases cause it, a lot of issues are there, and almost every doctor is trained in constipation. Simply, I would say that easily.
Okay, fair enough. Now, you talked about X-ray, so you can X-ray and see my poop?
No, you have to wear these special Clark Kent glasses. If I take them off or I put them on, then the X-ray vision comes on. But X-ray is an imaging technique where you can see either poop inside the colon, or you can see abnormalities that can sometimes be visible. And nowadays, with the 21st century, we have CAT scans and MRIs and other techniques that also do the same.
So he's mentioned that twice now too, like blockage or abnormalities. So that's something to keep in mind. Also, if you're having constipation a lot, it might not be something so simple too. So don't disregard your symptoms. Definitely see a doctor. All right, CAT scan, CT scan?
Yes, a CT scan may be an imaging technique that can be used in certain circumstances. If you're not getting better and you're sick, that may be an opportunity to evaluate you also.
So don't think your doctor's crazy if they try to order you a CT scan for your abdomen due to constipation. Fair enough. I know patients are always concerned about taking off work or finding time and money to do testing, and
that's all very important. And then there are medical therapies. You can give the patients medicines, including laxatives and enemas and fiber products that can allow the bowels to move a little bit faster. So those things are very important also, and for that you have to seek medical help. So if you are not able to go, then definitely you will be treated with some medical therapy, and surgery is usually the last resort. If you can't poop for weeks and you have problems, then you come talk to a guy like me. Mm-hmm. But most of the medical treatment that we have for constipation seems to really work very well.
More minor. Now, when you get that type of testing like X-ray or CT, do you get results back right away? Do you have to, a doctor has to read it to you? Can I look at it and tell what it's saying? Or
you don't have these magic glasses?
The Clark Kent.
The Clark Kent glasses? No. So CAT scan is read by radiologists and other doctors, and sometimes the reports come out. So there are medical professionals there to help you with that, definitely.
Okay, so if you start getting medical testing, expect to have a couple appointments coming up, have the doctor read it. And then colonoscopy, I guess you said surgery is the last resort, but last resort in diagnostics would be colonoscopy. So that's an actual physical visual exam where you're using a scope, correct?
Our time is going to be running out, but I wanted to talk about two things. One is stress. If you have a stressful situation, your body is going to hold it and you won't be able to go. So relax, have less anxiety, and that will allow you to have a better and good bowel function. Second, bowel function gets worse with age. So as we get older, constipation becomes a big problem. There are millions of Americans who are in their 60s and 70s and 80s.
Very true.
And
aging.
So aging is a natural process, and constipation gets to be a problem because we are not eating as much fiber. So our grandpas and grandmas, if you guys are listening out there, please add a fiber supplement that will add extra fiber and hopefully allow you to move your bowels better.
Yeah, and stay active. We try to encourage our parents to exercise with us. Sometimes we do the 5 rice exercise at home. Even eating good foods, we know they can't eat everything or they don't want everything. So we encourage them, other methods of getting types of fiber in their diet.
And guys, we have just touched on this. This is our first time, so we will take some questions from all of you guys in the future. I'm very excited that we have started this process, and hopefully
Thank you so much.
this will help some people out there
Yeah.
be less constipated for now.
And please tell us your story. That's what we're here for. So, but if you have any questions, comment. We'll be posting these, so they'll be streamed on all of our social channels. So keep in touch with us, and we'll be back next week. I'll let you know the topic on hopefully Monday.
Thank you, guys. Hopefully everybody's great. Eat more fiber. That's what I can tell you. That'll help everything.
But tonight, I think we're gonna get pizza because you were talking about it too much. I'm sorry. All right. Thank you, and good night, everybody.
Everybody have a fantastic evening. Thank you very much for listening to the Booty Doc Talk. Thank you.
That's right. Bye. Good
Take care. Thank you.